We're ready to start now.
Okay.
Okay. Good evening, and welcome to the March edition of the Ask Mary and Pat Show. We're grateful that you've taken time to join us tonight as we continue our mission of keeping Mississippi families informed, empowered, and connected to the resources that matters most. My name is Mary Fenner, part of Oak Hill's Medicaid Application Administrator team, and I'm joined by my colleague, Patricia Pat Bogan.
We honor the leadership of Oak Hill Regional Community Development Corporation, Dr. Michael O. Minor, Executive Director, Lottie Minor, Project Director, and Berta Taylor, Lead Navigator, Project Administrator. Our contact number is 662-298-3584 or connect at healthytogethermississippi.org.
Okay, tonight's conversation is at a pivotal moment. Mississippi families are navigating Medicaid and CHIP renewals, marketplace transitions, child care instability, and new updates affecting SNAP, healthcare access, and family well-being. Our goal is to break down these changes clearly, offer practical guidance, and highlight the community partners, especially our federally qualified health centers who stand ready to help. As always, the Ask Mary and Pat show blends trusted information, real life questions, and faith-rooted encouragement to help families make confident decisions. We invite you to stay engaged, take notes, and share this session with others who may benefit. Please type your questions and comments in the chat.
Okay, for our March 2026 updates, we have SNAP benefits in Mississippi, March 2026. The current status, SNAP benefits continue to be issued to eligible households. What's changing? Federal costs shifting proposals remain under debate. Mississippi agencies are preparing for the stricter income and asset verification. Families should expect more frequent requests for documentation at the application and recertification. What families should do now: keep contact information up to date with MDHS, respond quickly to letters, texts, and portal messages, save pay stubs, child care receipts, and household expense records.
Where we at, Pat? At the part where,
Child care vouchers.
okay, hold on. Okay, child care vouchers updates. And you might have to do that first one for me.
Wait list remains high. Approximately 16,000 families are still waiting for child care assistance. Funding remains far below the level needed to stabilize providers.
Okay. Tri-share pilot. The 1 million employer-employee state model continues as a small pilot, not a system-wide solution. Impact on families, parents, risk reduced hours or job loss. Providers continue to face staffing shortages and closures. Children experience inconsistent care in learning environments.
And Medicaid and CHIP renewals, coverage gaps, and dental care. Coverage basics remain unchanged. Doctor visits, hospital care, immunizations, and preventive services are still covered. Dental care remains mandatory for CHIP and included under Medicaid's EPSDT benefit. Dental services include preventive exams, cleanings, fluoride and sealants, restorative fillings and crowns, emergency care and medically necessary extractions. Most children qualify for 2 exams and 2 cleanings per year. Post-unwinding realities. Many families have experienced coverage interruptions due to paperwork issues. Children may still qualify even if parents move to marketplace plans. Families should update contact information with Medicaid, open and respond to all renewal mail, seek help immediately if coverage lapses.
Okay, federally qualified health centers. Why FQHCs matter right now? They remain the most stable access point for care during coverage transitions. They offer sliding fee scales for uninsured families. Many provide on-site help with Medicaid, CHIP, and marketplace enrollment. They connect families to food assistance, WIC, behavioral health, and community resources.
Okay, and again, we want you to put your questions in the chat. And of course, we're down to the questions and answers. Do you want to start first, Mary?
Okay, I'll start. Are SNAP benefits still being issued? Yes, benefits continue, but families should expect tighter verification and more paperwork.
Okay. Why is the child care voucher wait list still so long? Okay, that's a good question. Federal pandemic funding expired, and state appropriations remain far below the level needed to meet demand.
Okay, we have another question. What is the state doing to address childcare shortages? The Tri-Share pilot helps a small number of families, but is not large enough to reduce the statewide wait list. So our suggestion, just hang in there.
Okay, what can families do while waiting for child care assistance? Stay in contact with DHS, explore community-based support, and communicate with local providers about flexible options.
Can families who lost Medicaid enroll in marketplace plans? Yes, losing Medicaid qualifies families for a special enrollment period. Children may still qualify for Medicaid CHIP, even if parents move to marketplace coverage. So I do have one that's pending now where her child has lost his Medicaid because she was over the income limit. So we're gonna have a conversation to see if she'll be eligible to apply for insurance for a child for marketplace coverage.
Okay. Okay. Do we have any questions in the chat? Okay, we have a question. Do Medicaid and CHIP still cover dental care? Yes, they do. Preventative, restorative, and emergency dental services remain covered for children.
What should families do if they're worried about losing coverage? Update contact information, which is very important. Respond to renewal notices quickly. That is very important as well. And seek help from FQHCs, Family Community Health Centers, or community partners. If you're in between getting your Medicaid done or applying for marketplace assistance, then you can always go to the federally qualified health centers where they can serve you on a sliding scale.
They may be wondering, what is marketplace coverage?
That's the Affordable Care Act at healthcare.gov. So if you have lost your Medicaid for whatever reason, one of your children have lost because maybe you were over the income limit, maybe you're making more than you were last year and you were denied. The children were denied because you were over the income limit. You can give us a call at 662-298-3584 and we can assist you with applying for health insurance through the marketplace at healthcare.gov.
Okay. Another one. How
How-
can federal,
Go ahead.
okay. How can federally qualified health centers support families right now? They can help quite a bit. That's really going to be your go-to at this point. They provide medical, dental, behavioral health, and enrollment assistance. And this is often on a sliding fee scale. And you can find these centers by searching online in your area. And you should be able to pull up a list of the federal qualified community health centers in your area.
And if you still can't find one in your area, just give us a call. We have someone on staff that works directly with the federally qualified health centers, and they can look up and find you one in your area. Anywhere in the state of Mississippi that you live, I'm sure it's a federally qualified health center in your area that you can go to. It might be two or three, but you can just contact us if you have an issue with finding a federally qualified health center.
I see a couple of questions in the chat, Mary. One
Okay.
is, you
Go
see,
ahead. Mhm.
okay. Now, one is I lost coverage and didn't realize it. What should I do right now? Okay, the main thing is you can contact your local Medicaid office and just go ahead and reapply, or you can contact us. And of course, Mary gave you the phone number, and I'll give it to you again, 662-298-3584, and we can assist you with completing that application. So we don't want you to just think that because you lost coverage, you're doomed. So go ahead and reapply, okay? We can assist you.
Okay, and there's another question. What documents are needed for Medicaid renewal? For renewal, you basically need the same documents that you had to use to apply the initial time. And the main one you would need is proof of income. If you're working, they need your previous month's check stubs, at least a whole entire month check stubs. That's one thing that they would need. Also, if you moved, if your phone number has changed, or you have a different email that you want to give them, then that information you give them, you can give them that as well. Because usually, sometimes if they need additional information, they may send you an email, or not only a letter, but an email requesting the information right away. So that'll get your application done quickly if you can respond to that email.
Okay, and just to add to that, what if they're self-employed? What kind of documents will they need for that?
Well, if they're self-employed, they need their tax return. Their tax return will show how much they made in the previous year, and they were divided up by 12 months to get a monthly income.
Okay, see another question. Can my benefits be cut off without warning? Well, normally they send a letter out or they may even send an email. And I've had some consumers to say that they received a call, they missed a call. So it's kind of unusual for them to cut your benefits off without warning, unless you've already completed your application and you did not submit the required documents. Now, if you didn't submit those documents, yes, they will.
They'll give you a letter stating what you need to submit, and they will give you time to submit it. But if you have not submitted those documents, or they will cut you off, and you will get a letter. You should get a letter stating that you have been denied for the reason, whatever reason it was that they. So you should get a warning. It shouldn't
Right.
be where you won't get a warning, but you should get a
Mhm.
warning. Now, if you moved and they were not able to contact you, you may get cut off and not get a warning because they weren't able to contact you to renew your Medicaid or to let you know that they received information stating that you have moved, or in the letter that they sent you came back to them.
Right.
They would cut your benefits off. Also, it's a thing with insurance. If you have other health insurance and if your child is on CHIP, you can't have CHIP and other health insurance at the same
Right.
time. So kids have been cut off because they found out that they had other health insurance. But the main reason why would be that they did not get the information they need in order to process your application or renew your application.
Send the letter to you. There will be a due date for the information.
Right.
So you make sure that you act on that, because if you don't get it in within that time period, now sometimes if their caseload's not that heavy, they may get a little extra time, but I wouldn't depend on that.
No.
Just make sure that you go ahead and you'll see that that end date for the information on the letter. So make sure you get it in, because now after that, no warning.
Right. But also, if you need more time to get the information, you can always contact them and let them know, well, I received this letter and you said I need to get the information 2 weeks from now, where I won't be able to get it within 2 weeks. So especially if you're waiting on to receive information from other sources and you haven't heard from them, to help verify the Medicaid. So you can let them know, well, I'm still waiting on a letter from, like, if you no longer have that health insurance. Well, I'm still waiting on a letter showing that I don't no longer have that health insurance. Anything that, well, I lost the copies of my check stub and I request my job to give me copies, and then that might take a little time. So you just need to keep them informed of what's going on. They may give you a little bit more time if you need additional time to get the information in, but you just have to let them know that you need more time. It's a question: if my hours at work change, do I need to report it right away? Well, you need to report any changes, especially income changes, to Medicaid. But one thing with Medicaid, if your child has been approved, and say for instance your income changed, he will stay on Medicaid for that entire year. They won't, but when it comes time for the renewal and you submit that new income information, then you might be over the income limit. But before then, your child is guaranteed 1 year for children. Now, if it's an adult, it's a different story. Now, if you're
Right.
an adult and you're on Medicaid and your income change, they will cut you off, or they will let you know we need additional information. But children are different. They try to help children as much as they can. So if your income has changed, if your work hours has changed, you can let them know that your work hours have changed and that your income has changed. But more than likely, if it's for your child, they won't get denied When it comes time to renewal, and then if you still have them changes, or if you're over the income limit, you will get denied at that point. Now, if you're applying for the first time, and when you first put your application in, then your income has changed, you need to let them know. But if they already have Medicaid and it's not time for the renewal, you should let them know, but your child will still have it until it's time for the renewal.
Okay. How should I switch Medicaid from another state to Mississippi? Or what what you'll need to do is contact the Medicaid office in the state that you were residing in and let them know that you're getting ready to, or you've moved to Mississippi. And of course, they will close that Medicaid. And then you go ahead and in the state of Mississippi, in your area, you apply for Mississippi Medicaid. Now you've got to make sure that they've closed your case in the other state before you can receive the Medicaid for Mississippi. But you will also, like I said, one of the main things is make sure that it's closed. And sometimes the Medicaid office, your worker will contact the other state and let them know that you've moved to Mississippi, but it's your job to make sure that you contact the state that you're moving from to let them know that you're moving to Mississippi.
And that is so true. It may be hard sometimes to contact
Yes,
the other state, but
yes,
you cannot have Medicaid in two different states. So you have to
right,
really ask them to send you a letter to let
right,
them know that Medicaid has been terminated in that particular state.
right,
If you need to call them and request a termination letter, letting them know. And also in the letter, it should show when the Medicaid was terminated.
right,
Some states will terminate in the middle of the month. Some won't terminate to the end of the month or either the beginning of the next month. So you have to make sure. I know in Mississippi, they don't terminate to the end of the month. So you will have that whole entire month, regardless of what goes on with your Medicaid. But some states
right.
do by the 15th or something like that.
That's true.
But you need a letter. You need
Yeah,
proof
you
that
have to have that letter.
Mhm. You need
And
proof
now
that, go ahead.
if you are, even if you're switching Medicaid to any state, you have to go through these same steps. But what would probably be good is before you leave that particular state, make sure that you get that taken care of and get that letter in your hand, so then you won't have to worry about continuing to have to reach out to that state Medicaid office. I didn't get the letter. Uh, can you send me the letter? So if you can, just try to take care of that before you move to Mississippi or to any other state, and then that way you won't have that problem. You can take that letter to the Medicaid office of the state that you are moving to.
Right. Especially if you intend on making Mississippi your permanent resident.
Right.
That's one of the things you should do. You should get a termination letter from the state from which you're leaving
Right.
to let Mississippi know at this date I no longer have Medicaid in Tennessee or Alabama or Louisiana. And therefore, once they see that it's terminated, it will start at the beginning of that next month if you get approved.
As we said, it may not happen overnight because, the various offices are busy. We've had consumers that tried to reach out uh, to the Medicaid office of the state that they were previously residing in. And sometimes it's hard to get in touch with your worker. And then sometimes, they may have a heavy caseload and can't get it to you right away. So, again, we suggest that you try to get that letter before you move. That would help a whole lot.
Right. So yeah, that really depends on you, and it's your responsibility to get that information. Sometimes the caseworker can help, but that's not a promise. They may not be able to do it. So it's best that you get that
You get
information,
it.
that you get it yourself because it's your responsibility. And if they don't have it,
Right.
the child will be denied. So, okay, explain presumptive Medicaid. Who's eligible? Now, presumptive Medicaid is when a person is pregnant, they're entitled to pregnancy benefits from the state of Mississippi.
Mhm.
They have to apply, they have to submit their due date, and they'll automatically get it. So it's anybody that's pregnant um, and that can apply and get presumptive Medicaid. Now, it's my understanding that there are a point, they'll have it for a year, I think, right? Because they'll give it to you for the 9 months and then what, 6 months
And after that,
after, right? So it's a little bit over a year that you'll be eligible for the Medicaid. So, and then your child, once the child is born, the child will automatically be put on Medicaid. Um, but you also have to, when it's time to renew for the child, you will have to do more than just what you did for the child. You also have to do a renewal
right,
application. So it's
right,
not an automatic thing. You have to do an actual renewal application. But for the most part, once the child is born, the child will automatically get on. Once you submit an application, let them know, let Medicaid know that you are pregnant and you submit a due date. And
Mhm.
most of the time, due dates do have to come from the doctor's
The
office,
doctor's office.
right? You have to have proof that
Expected.
your expected due date, and then it goes from there.
Mhm. Now, at some point, they were working on approving presumptive Medicaid where, if you went to the emergency room, to the hospital, and it was determined that you were pregnant. Now, they were able to submit that information and presumptive Medicaid, let's say, kicked in during that time, but I'm not sure if that's active right now or not.
I'm not sure either. That would be something that we can look into and provide you additional information that's needed, if it's needed. Okay, I don't have a printer or scanner. How am I supposed to send documents? Okay, what you can do when it comes to sending documents, if you don't have a way to send documents, if you don't have, you can go to library and fax the information. Will be a fax number on the letter if they're requesting additional information. Also on Medicaid.gov. MedicaidMS.gov. Each office has their fax number on there, their phone number and their fax number. And if you just need to fax them information, you can just fax it to them. You would have to. Now, if you can't get to the library or anywhere to get the information faxed, you can let us know. We will get the information to that particular office for you. That's one of the things that we do. So you can let us know that I need to send my proof of income, but I don't have no way to send it to them. If you can get it
Right.
to us, then we'll get it to them.
Right. And if you have your worker's email address, of course, you can take a picture of it and you can email it. But again, as Mary said, we're here to help you.
Right. So email is one of the options. And most of the time, if you can find out your worker's name, their name is part of the email, so it wouldn't be hard to figure out the email or whoever answers the phone. If you call the office and you let them know who your worker is, and they can give you that worker's email address.
I'm taking care of my grandkids. Can I get help for them? Okay, now if those children are residing with you and if they're residing with you, you can get Medicaid for them. But some of the documents you will need, you will have to have proof that you are their grandchild, and that would include the mother's birth certificate and showing the relationship, your relationship with her,
You don't
and then
necessarily have to show relationship with the parents because it might be uh, a parent that's no longer you don't have a relationship with. But what you do need to do is let them know that the child, you can apply for Medicaid. Let them know that the child is staying in your household. Your income would not be used to get the
right,
child Medicaid, but they may request maybe school records or show that the child is going to school in your area or that you are the guardian, but you do not have to be a legal guardian to apply for Medicaid for your grandchild.
right,
All right.
right,
You just have to tell them that your grandchild is living with you right now. Now, if the grandchild has had Medicaid under their mother, it
yeah,
might be some extenuating circumstances that you have to let them know that the grandchild is no longer with the mother, but that she's now, or that child is now living with you. I've had recently, I've had two grandparents to apply for Medicaid for their grandchild, and it shouldn't be uh, uh, a long drawn out thing. Most of the time, they just have to know because sometimes the child is not on Medicaid any longer. They missed
right,
the renewal, whatever, so the child no longer has Medicaid. They just have to know that the child is in your household.
right.
You want to apply for Medicaid for them.
Yeah, and it has been in the past where, they wanted some type of proof that that child was um your grandchild, but as she said, the school records will basically show that that child is living with you. Well, it
Right.
should be the same address, hopefully.
Now, if you're applying for Medicaid for yourself, like
Oh,
you applying for your child, your grandchild, and then you also want Medicaid for yourself. Now,
okay.
that's an entirely different situation.
Mhm.
You're gonna have to show proof that that's your grandchild.
Yeah.
And that's when the birth certificates come in.
Mm.
We even, and everybody should know that obituaries are legal documents. I've
Mm.
had a consumer when I was working for Medicaid. She brought in 10 obituaries to show that her great great grandfather was a brother down the line with the grandfather of the
From
kids
that
that
parent.
she was
Mm.
right, that she had in her office. They were really cousins, but she needed to show their relationship. And they will use obituaries to where you can prove relationship, but that type of thing is sort of rare because most of the time adults, if you're working, you're not going to be eligible for Medicaid anyway. If
True.
you have any type of income coming in, being Social Security, whatever, you're going to be over the income
Right.
limit. So
The income limit is very low.
it's very low for adults. It's very low for adults. You have to be, I ain't gonna say that. But anyway, it's very, very low for adults in order to adults to get Medicaid, and you do have to have a child that's living in your household under the age of 18.
Right.
Yes,
Right.
18 and under, yeah. So I feel like I'm doing everything right, but still losing coverage. Why is this happening? We have resources, not resources, we have sources that we can contact to see why you're constantly getting denied. And it's
Right.
probably a little small thing, and maybe you're not getting the letter to let you know that they need this additional information to get your child approved. But contact us and let us know, and we can let you know the reason why, because maybe the letter went someplace else, maybe you didn't get the
Right.
letter, you
And they
know,
didn't get it in time.
get the information in time that you needed. And it might be just a matter of just reapplying. We can help you do that. We can help you to reapply for Medicaid because I have a case now where the lady is waiting on Medicaid for her child and she's wondering why. She hasn't been able to get in touch with her worker and she's wondering why.
Mhm.
Well, I contact my source and it's just a matter she need to reapply. And she may not have known that, but she needs to reapply in order for her child to get Medicaid. So just
Okay.
let us know, and we can help you the best way that we can.
Right.
And you already know the number,
Mhm.
662-298-3584. And let the person know that answers that you need assistance with getting Medicaid, and she or whoever answers will send you to the person in your area so that they can help you get Medicaid. So it's another question, what type of income is counted?
Mhm.
The
Of
income,
course,
go ahead.
Mary's gone over that, but she'll tell you again.
Yeah, it's anything, your work, if you have a job, your pay stubs.
Stuff.
Only thing that's not counted is if you get child support, it's not counted. So they do not count child support at all. But if you're getting workers' comp, or if you're getting if you're off work,
Benefits.
benefits like you what is that called when you're applying for or trying to find a job? If you're getting that, that counts. But the one thing that does not count is child support. And I don't think they count if you're getting
Yeah, Social Security.
Social Security is
Unemployment benefits.
unemployment benefits is counted. Social Security is counted. Depending on what type of Social Security it is.
Right.
If it's
SSI.
SSI, it's not counted. But if you get disability, Social Security other than SSI, that's counted. Or if you're getting retirement, Social Security, that's counted. Only thing that's not counted is SSI. That's not counted.
For those questions.
Do we have any more questions? Did we do all of our did you talk about Medicaid and CHIP still covers dental care? Did we get to that question? Okay. And I think how can federally qualified health centers support families right now? Did we get to that question? Okay. So it looks like we don't have any more questions. Okay, there's another one in the chat.
If I just give up on the process, what happens then?
Nothing.
Well, one thing is we encourage you not to do that.
Right.
And we've had some that, they just
Yes.
got so frustrated,
Right.
because they, they sent in check stubs
Right.
and when they say, for instance, this is March, if they're requesting February check stubs, they're meaning the ones that you received in February. And of course, some people, take it as, as long as it shows something in February, uh, but it has to be the ones that you've received in February. But we just want to encourage you not to give up. Just keep asking your worker, what is it? What is it that I need? And again, as Mary said earlier, we're here to help you. And we've actually helped some people that got to that point of giving up. So
Right.
we
They wanted to
stepped
give
in.
up. Right. Because they got frustrated with the process because it looked like
Right.
everything that they did was doing, the child still didn't
Mhm.
get approved and they kept
Right.
requesting more information. But we have help. We have helped them to be able to get it. Because I know sometimes the process can be frustrating. I know that. But if you need help with the process, just contact one of us and we will help you to the best of our
Right.
ability. We'll find out
Mhm.
for you why, what's going on with it, because sometimes you don't know. Maybe you missed a letter. Maybe the letter got lost in the mail. That's a possibility. I know someone was waiting on approval and come find out they had to reapply, but we were able to contact and find out that they had to reapply, and then we just put in another application for them. So that just let us know. We don't want you to give up on the process.
No,
If your
no,
child needs Medicaid, and we know that medical expenses are so expensive, and you're
yes,
constantly coming out of your pocket. And if there's a way that we can help you with the process,
right,
let us know. Just let us know.
right. Please don't give up.
Don't.
And if you move, please let the Medicaid office know,
Right.
because that letter, if they send you a letter and you're not at that address, it says return to a sender or whatever, they're not going to forward it. It's going back to Medicaid.
Right. They don't do forwarding mail. So you actually have to let them know that you have moved. So how do I know if I'm still covered or not? If you have any questions about whether you're still covered or not, contact us and we can find out that information for you. We have contacts at the Medicaid office that can
Mhm.
just look it up and just let us know that whether you are still covered. And that's the next one. Yeah, whether you are still
Yes.
covered or not. If most time if you go to the doctor, take your child to the doctor. That's how a lot of people know.
Now they find out.
That's how they find out because they didn't get the letter or they didn't see the letter or because sometimes mail does it gets lost. So
Right.
that would be the best way if you take your child to the doctor, or if you call the doctor's office and ask them, they'll let you know whether that
Right.
child still has Medicaid or not. But if you
Right.
don't want to contact them, you can contact us and we can find out for you if they're still covered.
Right. And you can call the Medicaid office as well.
You can call the Medicaid office, but I know sometimes you may not be able to get through. But if you call
Right.
and you can't get through, you call, just let us know and we can try to get that information for you.
Why do my kids qualify, but I don't? Okay, now, one of the things with that is going to be based on income. And as we mentioned earlier, the income limit for a parent to receive Medicaid with their children, the income limit is very low. But also, you have to cooperate with child support. And we have some parents that don't want to do that, but you will have to cooperate with child support in order for you to be eligible, as well as the income factor.
And you need to stay in constant contact with child support because if ever at some point of time, if they ask you, do you want to cooperate with child support, and you said no, well, they got that little check mark in the system saying
Mhm.
that this person do not want to cooperate with child support. If you change your mind, it's sort of hard to get that little check mark off, but it's
Sure is.
possible. I've had people that say, well, I want to cooperate now. And every time they
Mhm.
apply, it'll pop up that they did not want to
They
cooperate.
did not want
So
to
if you
cooperate.
change your mind, if you decided at some point in time, now I want to cooperate with child support because I need Medicaid for myself as well as my child, you need to contact child support and let them know that you now want to cooperate with them, give them
Right.
the name and information that they need, and they will follow up on the process, and then you can reapply for Medicaid for yourself after you let them know, after you let child support know that you want to participate or cooperate with child support,
Right.
then they will put that information into the system, answer all the questions that they ask you. They'll put the information in the system, then you can reapply for Medicaid for yourself. Now, it depends on your income. So
Right.
if you're working, more than likely you're not going to be eligible for Medicaid. But if you're not working and you're living at home with someone, or they will only count they will only count your just you and your child or you and your children. They will not count the person's income that you're living with. Now, if it's your husband, then that's a different story. But
Right.
if it's just someone that you live with, you could be living with your mom or a relative, then you just let them know that you're living with someone, and that person's income does not count. But more than likely, the reason why you didn't qualify, if you were over the income limit, you had a child that was over the age of 18, or you did not cooperate with child support. So those the three things would keep you
Mhm.
ineligible for Medicaid.
Yeah, once they turn 18, then you're disqualified.
And the
But even
parents
if
is
this is your first time,
right,
and you decide that you want to apply for Medicaid, go ahead. And then if you have these children, that's first thing they're going to ask if you're cooperating with child support. So we'll just go ahead and take care of that first. Let's go to your the child support office in whatever area um, that takes care of yours. Let's make sure you go there and just tell them you want to cooperate with child support, and that will go into the system. So Medicaid will pick that up when you do decide to apply.
right, yes. Are there any more questions in the chat? And you can always contact us at a later date if you have questions that you don't, if you have questions that come up after this, then you can always contact the office and let us know, and we can find the information out for you. If you
Right.
like something and we couldn't give you the information tonight, just let us know. We will get the information to you. You can go on our website, and therefore you can check the information down that way too on our website. So
I'm not sure if we have any on Facebook or not, but as Mary said, if we can't get to those, we can always cover those later.
right, you can always contact us and we'll get to those later. So Duke, do we have any more questions?
I'm checking now, but I don't believe we do.
Okay.
No more questions.
Okay.
Thank
Since
you.
we do not have any more questions, so we'd like to thank you for spending your evening with us and for being a part of a community that cares deeply about the well-being of Mississippi's children and families. Tonight's conversation reminds us that while policies and programs may shift, our commitment to supporting one another remains steady. Stay connected, keep your information updated with state agencies, and reach out to your local federally qualified health center for help with coverage, care, and community support. Remember, informed families are empowered families, so you need to stay connected and find out the information that you need. You may connect with us at 662-298-3584 or connect at healthytogetherms.org. And it's popped up on the screen. You can see it now. So it's healthytogetherms.org. So you can use, it's called connect at healthytogetherms.org. We look forward to seeing you again at our next Ask Mary and Pat show on Monday, April 27th at 6:30 p.m. Until then, stay encouraged, stay connected, and continue uplifting one another as we work together to strengthen families across Mississippi. So it takes all of us. It takes all of us. So I gave you information to contact us if you need additional information. At the bottom of the screen, you can see the other programs that we have at Healthy Together Mississippi. So if you need any type of health with other programs that we have, please give us a call and we'll be able to help you the best way that we can because it's all about helping the people of Mississippi get the information and the help that they need. Good night, everyone.
Thank you.